Good afternoon, everyone. This is Dr. Greg Raduca with Let's Be Clear, Georgia, a collaborative to prevent marijuana abuse. I want to welcome everyone to today's webinar. We think we have extremely important information to present to you today. And with us today are two great experts that are going to be co-presenting. And they are Dr. Kevin Sabet, who is Smart Approaches to Marijuana President and CEO. He's a co-founder of that terrific organization that is doing so much nationally to prevent the spread of very unwise and unsafe marijuana policies and legislation around the country. So glad that Kevin could be with us today. In my book, he's probably the foremost expert in the country to be speaking to us on this topic. Also with us today is Dr. Michael Ellis, and Dr. Ellis is a psychiatrist who specializes in autism. He's a child and adolescent psychiatrist, graduated from the University of Florida, Nova Southeastern University School of Osteopathic Medicine, in the top 3% of his class, and later attended the Medical College of Georgia for general psychiatry. The overwhelming majority of his practice is in treating autism spectrum disorder, and Dr. Ellis has a child with ASD, making him an expert with ASD not only personally but also professionally. Dr. Ellis has a book on autism that is about to be published by Oxford University Press the end of this year. He served for 9 years on the Committee on Lifelong Learning for the Academy of Child and Adolescent Psychiatry and is the Medical Director of Child and Adolescent Psychiatry at the Bradley Center. So Dr. Ellis comes to us with many credentials, but as I mentioned, he is very personally as well as professionally dedicated to the purposes that we're going to be discussing in today's webinar. So here are our topics for today. Dr. Sabet is going to give us a background on medical marijuana issues. He's also going to talk about the political landscape from the federal perspective regarding PTSD and autism. Many of you may already know that both PTSD and autism are going to be the fronts on which the marijuana lobby is already focusing in on in Georgia. And pediatric uses of medical cannabis in particular, as we'll discuss later. Dr. Ellis is going to talk about what the science says about autism and PTSD. I'm going to say a little about developments in Georgia regarding approaches by the marijuana lobby regarding these two conditions, and also say a little bit about what peer members and stakeholders can do at this point in time. It's certainly not too early in the year. And as time allows, we're going to have questions and answers at the end. You can also email your answers, email your questions. We'll give you an email address at the end of the webinar to do that so that all questions arising during the webinar can be answered. I am going to turn it over at this point to Dr. Sabet.
Thanks so much. Appreciate it, Greg, and appreciate Let's Be Clear and Dr. Ellis as well for joining us. Let's talk about his marijuana medicine to start out with, because this is a question we get a lot. And actually, the answer is complicated. Well, it's sort of like asking, is opium medicine? We don't smoke marijuana or any other medicine. And no research has shown by smoking or even vaporizing raw marijuana that it has medicinal value in terms of it being safe and effective. But there are pills and other items containing marijuana ingredients that are available now at a pharmacy. For example, Marinol, and I'll talk about that a little bit later. The point is, marijuana is a very complex plant. It has hundreds of components in it. One of those, one category of those components is called cannabinoids. That means it acts on the brain, cannabinoid receptors. And some of them have proven to be safe and effective. Honestly, the best answer is maybe. There's research going on right now is determining whether or not there are other medications based on marijuana that could be medicine. And I think that's actually, again, the most interesting part of this is that the research is happening. It needs to continue to happen, and we're going to learn a lot more. But that's very different than saying marijuana is medicine or it's near being medicine, because we have to separate the individual components of marijuana, some of which are cannabinoids that act on the brain. Others are other things, not cannabinoids, like flavonoids, for example. We have to separate that and just this idea of smoking the leafy, the flowers of THC. What about Schedule 1? People say we can't really do the research because it is Schedule 1. That's actually not happening. That's not true at all. There is a lot of research going on right now, and I think really scheduling is a matter of extreme confusion. There are some components of marijuana, like I said, that are different schedules, like Schedule 3. So that's important to know. And it is true, it is harder to research a Schedule 1 substance, certainly, than a Schedule 3 or 4 substance, but it's certainly not impossible. And about 300 researchers today have licenses to do the research on marijuana as a Schedule 1 drug. Some people think that because marijuana is Schedule 1, it means that it's treated worse than heroin or equivalent to heroin, because heroin is also Schedule 1. That's also not true. Scheduling has nothing to do with legal ramifications, and it's just really a matter of a lot of confusion. Scheduling is simply a category that Congress came up with to define what is a medicine and what is addictive. It's totally imperfect, but it is the category that we have. And marijuana as a raw substance does not meet the criteria for anything less than Schedule 1, simply because it is not proven raw marijuana to have the medicinal use as defined with a dosage, safety, efficacy, etc. That doesn't mean there are not thousands of people who anecdotally have said marijuana helps them with whatever condition they have. And for some of them, they're not, we're not saying they're all lying. But the point is, those are usually the components acting. And in large-scale clinical trials, it has not been, it appears right now that marijuana would meet anything other than Schedule 1. What about the fact that it's been used for thousands of years? We've heard that a lot, right? Marijuana as a medicine has been used for thousands of years. It's true. Cannabis was used thousands of years ago, just like opium was. But it has never achieved the either medical or, frankly, even recreational status in the West than something like alcohol has. And so, it has been used by a few populations throughout time, never as a widespread medicine and by a large swath of the world's population. And certainly we get this a lot of, thing about it being like alcohol. It's totally incomparable to alcohol when it comes to a cultural, when it comes to culture. And I think that's a very important distinction we have to make. What do the medical associations say? Basically, they have said that marijuana is not a medicine, that smoked marijuana is not a medicine, that what states are doing by passing medicine by voter referenda or legislature is totally the wrong way to determine what a medicine is. And so that's why every major medical association, you see them here, has said that marijuana as a smoke material is not a medicine. But they've also all said, let's do the research. And again, that's what we want to do. I think reasonable people want to do the research. We're going to do it. We're doing it as we speak. But unfortunately, obviously, research takes time. I understand that. But it is, but that's just the reality of it, is that the major medical associations have not accepted it whatsoever. So let's talk about some marijuana-based medicines. The one that kind of came to the scene in the beginning was called Sativex by a company, GW Pharmaceuticals. And that company is based in England. They grow marijuana in a controlled environment, actually in an unknown location, only known to the people who are growing it. The UK government has given them a legal license to grow it. And the US government has allowed Sativex to be imported legally for clinical trials. It's being studied right now. It's doing much better for certain conditions than it's being tested out for cancer, pain, as well as some other conditions. It's not a miracle drug by any means. In fact, a recent study found that it really didn't do well for cancer pain. There's a lot of reasons for that. Cancer studies are notoriously difficult. Recruiting is difficult. There's a lot of difficulties with doing late-stage cancer pain studies, but it's not as the blockbuster I think they were hoping it would be. It is approved in dozens of countries already, and I think for the U.S. we just have a higher standard for approval. It may be some time until it is approved here, but they have been studying it for almost a decade. What is it? It is a THC and CBD 1-to-1 ratio insofar as CBD is another cannabinoid, except this cannabinoid doesn't make you high, and it actually takes a lot of the high away. So THC and CBD are used together as an extract of raw marijuana. In fact, a lot of people say, well, it's synthetic, so it can't be helpful, or, it's only a few components. It's not the whole plant. We need the whole plant. Actually, both of those statements are untrue. It is the whole plant, in fact. It's a whole plant extract, except the main ingredients that are bolstered are THC and CBD. That's a very important distinction, because it means that it still has some of the other trace amounts of the flavonoids and other components. It's administered via an oral mouth spray, as I said. There's another medication from GW called Epidiolex. This is an oil, which is pure CBD. And there is no THC other than very trace amounts. It's also being used. The FDA has a couple hundred kids right now getting it as part of the clinical trial for different kinds of intractable epilepsy, seizures, and it may be approved very soon. We're not sure. If I put money on it, I would put money on Epidiolex being approved before Sativex, even though Sativex has been in the process for longer, but we will see. Marinol, what is Marinol? Marinol came about 30 years ago when the National Cancer Institute decided to look at it for nausea and also some cancer pain, vomiting, etc. And actually was produced by the National Cancer Institute and given on a clinical trial basis even before FDA approval, which is very interesting. Actually, I think that's could be a model for researching marijuana-based medications, is for some people, you could allow them to have it before approval if they understood the risks in a very controlled manner, so that they wouldn't have to resort to these medical marijuana stores, which are really hot shops masquerading as quote-unquote dispensaries, which is the old term for pharmacy from around 200 years ago that they have been using. Anyhow, Epidiolex is out there. Marinol has been around for 30 years. It's THC produced in a laboratory. It means your brain has no idea the difference between that or THC that you would get naturally in marijuana plants. And it's a pill. It's been available for 30 years as a prescription drug. It started out as a Schedule II drug, and in 1999 the FDA put it as a Schedule III drug, meaning it's even easier to get than before. It's not widely used. It's used by some people, but it's certainly not any kind of huge blockbuster profit driver for the pharmaceutical industry by any means, because there are better medications, frankly better than Marinol or the marijuana ones, which I think is another good point to make, is that for many of these there are superior medications. Well, now we go to kind of what's happening in the different states. There have been multiple studies about who's actually getting marijuana in the average state. Basically, the profile seems to be a white male in his 30s or 40s with a history of alcohol and drug abuse, no history of life-threatening illness. Most of these people had tried marijuana by the time they were 19, and the vast majority of them are white patients, Caucasian patients who had used other drugs in their lifetime. So this was like just not exactly a profile of someone who had not used drugs before, but were just looking for a medication. The average person has tried marijuana, they're experienced with it, which is obviously not the average experience for most people, because most people are not regular users of marijuana, nor have they tried it before 19. Only a small proportion of medical marijuana users are reporting any serious illness. So in Colorado, it's something like 2% reported cancer. Again, that doesn't mean they used marijuana for cancer. It just means they had cancer when they went to the pot shop. Less than 1% HIV/AIDS. I mean, for people with compromised immune systems, especially given the current incredibly helpful, life-saving drugs used now for people with HIV, this is not something that doctors are giving to people with HIV. Glaucoma, it's a terrible medication for glaucoma, despite the rhetoric around it. The Glaucoma Institute is totally against it. the foundation has said, do not use marijuana. It's very interesting. And in the states, the numbers are very similar. I mean, this is just, we gave you a couple of states here, but it's very similar across the country. The majority of medical marijuana users really use marijuana to treat what they call chronic or severe pain. That's really the number one thing is chronic pain. Obviously very difficult to define, doesn't mean it's not a problem. It's a huge problem, chronic pain, obviously. But I think it does mean that it's extremely subjective. Very interesting to look at kind of where this thing came from. This whole issue is very, very interesting. And, essentially what we have been seeing is that folks have used medical marijuana. And in fact, Keith Stroop, the founder of NORML, has said that they've used it and they will use it and they are using it as a red herring to give marijuana a good name. And so, it's just, this is not surprising that a lot of these laws are written so loosely. And when they are written in a very tight fashion, like in New York, we've seen that, there have been protests by the medical marijuana lobby. And so for many people, this has been an open door to full legalization. Not everybody, but a lot of the money behind it has been the same people that are funding legalization. Absolutely true. Very interesting that Alan St. Pierre, the director of NORML, admitted in a TV interview actually with me, we were debating. He said in California, marijuana has been de facto legalized under the guise of medical marijuana. So folks the smoke screen is gone. I mean, they're admitting it, that, actually, this has been really de facto legalization. Whereas in the beginning, they said this has nothing to do with legalization. It's only for medical use. Very interesting studies coming out about use in certain states versus other states. We've seen, this is a bit of an older study, that's why there's fewer states there. It's 2004 in terms of what they looked at it. That past-year marijuana use independence was higher in those states. And they're still looking at why that was the case, but we've certainly seen that is the case for many of these states, that there has been an increase in use. Colorado, obviously they legalized marijuana for non-medical use, but they have seen and they saw an increase as soon as they implemented a widespread commercial market for medical, quote-unquote, medical marijuana. They did see an increase in fatal crashes with marijuana testing positive for many of these drivers. So this is absolutely a growing issue. Very interesting thing in terms of what we've been hearing. There was this documentary a year ago called Weed by Sanjay Gupta. And essentially what, the documentary followed the case of a little girl who was getting relief from CBD oil. And it was basically saying, everything you know about marijuana is wrong, it's actually medicinal, etc. Problem was it really confused components like CBD with the herbal material marijuana, the raw marijuana that you smoke. So it was extremely confusing for people. And it's still confusing to this day. I just 20 minutes ago did an interview with ESPN about marijuana in the NFL, and they're confusing left and right the herbal material, which gets you high because it has THC in it, and the other ways that it might be medicinal. It's really, really unfortunate with the way those have been totally confused. CBD has actually been bred out of modern marijuana, and it's not even in modern marijuana anymore. In terms of the average person who's using a joint, CBD is out of there because it doesn't make you high. And if you're buying marijuana, you obviously want it to make you high. So a lot of today's marijuana, they don't have CBD in it. You can find CBD strains in some dispensaries in California, but in reality, the average joint does not make you high at all. But I think that these media documentaries just have really confused the entire issue. There is some promising research showing CBD's effectiveness, and that we actually have seen that there is some promise. And so the FDA has what they call an investigational new drug program, which means they're looking into it, basically a study. And it's showing to be very promising. And we are encouraging those studies to happen. So doctors are accessing purified CBD through this investigational new drug program. But the problem is there's a lot of CBD products on the market today that are really advertising the things that they don't even know. And when the FDA is looking into them, they're finding out they actually they're not high in CBD. Or if they are high in CBD, these 3 products, for example, that are on the internet, you can buy in about 5 seconds, they're very high in THC. I mean, the idea that you would be giving this to young children with developing brains with this high amount of THC, it's a very high, that's 6.9% is what the average was 10 years ago. I mean, that is a high amount of THC. It's also, by the way, unclear whether these ratios are even accurate. And so there has been a real problem with these quote-unquote, I'll call them artisanal CBD products that do not have the anticipated effect. Many parents are left holding the bag and figuring out what they're supposed to do next because they thought this was going to be helpful.
So, Dr. Smith, that means that people in Georgia could order products that are that high in THC over the internet?
Oh, absolutely.
Okay.
So there has been some studies on this, and essentially the University of Colorado actually looked at 58 children with severe epilepsy. So basically they were the artisanal products, and what they found was of the 58 children with severe epilepsy, there was some seizure reduction in about 1/3 of those patients. For 2 children, there was absolutely no improvement, but there were adverse effects in almost half the patients. So a 1/5 of them experienced new seizures. So the issue is we don't know what's in these products. By the way, 1 patient died. We don't know what's in these products in the artisanal CBD. There's nobody looking at the way they're advertising. It's extremely, extremely dangerous. And then they actually did a study looking at Epidiolex CBD, and basically what they found was that there were 23 children that were dosed 5 milligrams a day, which was gradually increased. And they found that after 3 months, 40% of them had a greater than 50% reduction in seizures. So, much better results, frankly, among people that, among kids using CBD where you actually knew what was inside. This is purified CBD, which is what Epidiolex is. And so I think that shows us we want to know what's in these products so that we're able to provide the right kind of care. I just wanted to put sort of one issue about where the political landscape is in Washington, D.C. around PTSD and autism, because that's what we're talking about today. Essentially, it's very hard for folks in Congress to say no to anyone who says they were a vet for anything, a veteran for the wars. And I think that you now have this push for PTSD among soldiers coming back from war, and it's tempting to sort of say, well, they should get anything that makes them feel better. But the problem with what we're seeing and what studies are showing is that actually in the long term, these are not helpful. They can actually cause mental illness. They can be extremely hazardous to some of these vets. And but the legalization groups are using PTSD as a way in to say, look, these poor desperate people need PTSD, and they're really playing off the fears of Americans. They're playing off of the idea that marijuana is harmless, that opiates are so much more harmful, and I think that is it's very, very problematic. Certainly, autism is another issue that is coming that hopefully Dr. Ellis can talk more about. But they're trying to go after the most vulnerable people you can imagine and say that they need marijuana, because it's very hard if you have a story for an elected official for them to say no to that, even though the science actually shows us the opposite. I think we're going to talk about some of that science.
All right, so at this point, thank you so much, Dr. Sabet. We're going to go ahead and turn it over to Dr. Ellis.
Okay. Well, thank you so much for having me. It's really a pleasure to be here. So today, of course, I'm going to talk about what the science says about autism spectrum disorder and PTSD, and then we'll discuss some other things as well. So first I want to start with cannabis and changes in the brain as far as what we do know. Of course, there's unfortunately still a lot that we do not know, and hopefully in the future there will be more studies that will hopefully be government funded so that we can get to the bottom of some of these things that are definitely a political issue right now. But in one study, long-term cannabis use in adolescents was associated with a decline in IQ by 5 to 6 points by the age of 38. So that means obviously if they were using cannabis as an adolescent, later on these people were studied at age 38 and their IQ was definitely much lower, or significantly lower I guess I should say. And then interestingly they found that stopping the cannabis didn't change this decrease in IQ. So it appears to be persistent and probably non-reversible neurocognitive changes. And of course the reason that this is more concerning in children is obviously their brains are still developing in adolescence, and even in children, of course, their brains are more so non-developed. So probably the younger the child, one would expect probably more neurocognitive changes as a result of cannabis, although, of course, this needs to be proved out even more than what we do have. So unfortunately, we're kind of in an environment where we do have some research, which is helpful, but we do not have enough research. And of course, I'm sure that that will change as the years go on in the near future. But heavy cannabis use has been associated with later depression and a doubling of the risk for psychosis. This we definitely know. We've known this for a long time. Psychiatrists were definitely taught that it does double using cannabis does double the risk for psychosis, and more so predispose you to schizophrenia. And I definitely teach the adolescents that use marijuana. I teach this to them in hopes that this will be enough of a deterrent that they choose to stop. One thing that I want to say as an aside is that a lot of the adolescents that I do see that smoke marijuana recreationally, they usually will tell me that they use marijuana because it makes them feel better, and they don't want the medicines that I'm giving them. They prefer to smoke marijuana because it helps with their depression and anxiety. And unfortunately, as usually is proven out, their depression and their anxiety actually ends up worsening in the long term. So, and we do know this to be true. So other changes, it is known that axonal connectivity is impaired in adults who are regular users. So this is obviously affecting the brain the connections in the brain, which obviously are important. Adults who used as adolescents have decreased volumes of their amygdala and hippocampus, and these are known to be involved in memory processing as well as other important processes. There are a multitude of other brain areas that we do know that are affected by cannabis use, and these are specifically involved in motivation and emotions and affect processing, which is clearly why using cannabis is definitely associated with what we call amotivation, or kind of a lack of motivation that develops. And since this cannabis or THC stays in your system for up to a month, these effects are very prolonged, which of course is concerning in a child or an adolescent. So cannabis, as most of you probably are already aware, has been proposed for pain and spasticity, nausea, appetite, multiple sclerosis, spinal cord injury, Tourette syndrome, epilepsy, and glaucoma. And as our previous speaker spoke, there is some evidence for use in epilepsy in certain cases, and there is some evidence for pain and spasticity and some of these other things, but not Tourette's or spinal cord injury. There essentially is no good evidence for cannabis in treating autism spectrum disorder, ADHD, or other developmental disabilities. And that's obviously the most important take-home point, is that there just is not the evidence to support this use. Unfortunately, cannabis for autism spectrum disorder has gained a lot of media and especially social media attention despite this lack of evidence, and that obviously has me and other medical professionals very concerned. And I have had a few patients or parents of patients start asking about cannabis and the oil, and if their child will be a candidate, and they have told me themselves that they have ordered it on the internet, and obviously I share with them my concern about this. There has only been one case report of a 6-year-old that had improvements in hyperactivity, irritability, lethargy, speech impairments, and stereotype movements. You know, the case report is the lowest form of evidence, so this honestly doesn't tell you a whole lot. So again, with this level of evidence, there is no way that any health professional would or should promote cannabis use or even really talk much about it except for the potential dangers at this point. So I want to talk about autism spectrum disorder and the statistics, and that will kind of give you more of an understanding of why this is likely to be an important issue over the next decade, not just in terms of autism spectrum, but as in terms of parents kind of wanting other alternative medicines or even considering marijuana for their child. So in 2000, there was 1 in 150 children who had autism spectrum disorder, according to the Centers for Disease Control and Prevention, or CDC. As of 2012, this number was 1 in 68 who have autism spectrum disorder, and this is essentially 1 in 42 boys and 1 in 189 girls. So of course, if you're a parent, this is quite concerning. You know, it's certainly a significant risk, especially if you, you know, if you know you are pregnant and you find out that you have a boy that you're pregnant with. You know, odds of 1 in 42 are really not that great, especially considering that autism spectrum disorder is a pretty significantly devastating illness or disorder. In Georgia, the statistics are a little higher. I should point out that the statistics or the prevalence of autism spectrum disorder does seem to vary county by county, and there has been research that has shown this. So, but in Georgia, there is 1 in 64 children that have autism spectrum disorder, which is 1 in 39 boys and 1 in 181 girls. So clearly it's because of these high numbers and the severity of the disorder that parents are definitely desperate to find help for their child. And honestly, you know, as I treat a large number of children with autism spectrum disorder, I pretty much find that parents are willing to do just about anything to help their child, as one would assume. But a lot of times they're not paying attention to the potential dangers. As has already been pointed out, I do have a daughter with autism. She's 11 now. She has ASD, and I do clearly understand why parents would be wanting to do whatever they can to help their child. But again, it can come at a significant cost. So, of course, as has already been pointed out, there's very poor evidence for the use of cannabis in treating autism spectrum disorder. But many of the symptoms that have been proposed to be treated by cannabis can be treated by current medicines and therapies that we already have. And I have found, although this isn't scientific, I have certainly found that a lot of the parents that consider alternative medicines and therapies, including marijuana, have not even tried the medications that we do have. For whatever reason, their idea is that marijuana or even other alternative medicines might be safer. And of course, that's not true. Since there's no cure for autism spectrum disorder and we do not offer a cure, oftentimes people do seek out alternative medicines. It is very much true that applied behavioral analysis is the only evidence-based treatment for the core symptoms of autism spectrum disorder. It also helps treat some of the associated symptoms. It has been shown to increase IQ and improve a multitude of behavioral symptoms, including aggression. It has also been shown to significantly improve eye contact and socialization and some of these other things. And it's interesting to me that other people have proposed that marijuana can do some of these things. And it's kind of ironic that we do have therapy that can definitely help with some of these symptoms. Although, again, it is not a cure, it is quite helpful and definitely evidence-based. As far as medications go for autism spectrum disorder, there are significant helpful medications that we do use that are FDA approved, and these are Risperdal and Abilify. These are the ones that are currently FDA approved, although we do use other medications that are similar to these at times. But Risperdal and Abilify are approved for irritability and tantrums and aggression and self-injurious behaviors associated with autism. These can be highly effective. I have had some parents come back after starting these medications and have felt like this is a miracle medication. Although I will caution you that there are side effects associated with Risperdal and Abilify, but they are at least known side effects, and we know how to treat them, we know how to monitor for them, and we are able to warn patients and parents about what some of these side effects are. And by these, just as an aside, I mean these medicines can increase blood sugar or cholesterol. They can cause movement disorders, although very, very rarely. So there are some side effects associated with these medications. And although they are not a miracle necessarily, they can feel like it to a parent who's dealing with a child who is frequently tantruming and having aggressive or self-injurious behavior. When these are cut down from them having a tantrum or self-harm behavior 5 times a day to having it once a week, that can seem like a miracle. There are other medications that we use, like stimulants, and just as an example, Concerta or Vyvanse. These can treat ADHD symptoms that are often associated with autism spectrum disorder. And these ADHD symptoms are inattention, hyperactivity, and impulsivity. And they can be quite effective. SSRIs, which many of you may understand about or have heard about, or selective serotonin reuptake inhibitors, definitely can help with decreasing anxiety or depression in those that have autism spectrum disorder and alleviate some of the associated symptoms. So in other words, it is not necessary for you to go to dangerous alternatives such as cannabis, in my opinion, unless, at the very least, unless you've tried all other medications, and then one would still have to be aware of the very serious potential side effects of cannabis and the unproven nature. And as others have pointed out already, it is very well known that you don't know what you're getting in the marijuana or even the cannabis oil. You don't know the percentages of the things that you're getting, and this could be dangerous. So in kind of switching gears to PTSD and cannabis, there was a 2015 study at Yale who showed that veterans with PTSD had worse outcomes actually if they used cannabis after they were diagnosed. And the cannabis was associated with worse PTSD symptoms, more violent behavior, and alcohol use. And it's ironic that cannabis has, of course, already been approved in at least 9 states that I'm aware of for PTSD without any evidence for its effectiveness and definitely evidence for its dangers in this population. So there are also effective treatments that we already have available for PTSD, including medication and therapy, just as with autism spectrum disorder. Again, there's likely no need to reach for cannabis in the first place. Highly effective therapies are exposure therapy or cognitive behavioral therapy and others. These are highly effective. Medications also can be helpful to treat PTSD, such as SSRIs, such as what we had already talked about with autism spectrum disorder. Some of these are Zoloft and Prozac, which other people may have heard of. Other medications that can be used are atypical antipsychotics, which sometimes can be very helpful for PTSD and those that may have hallucinations or insomnia and other such things. So I wanted to conclude my part with what should you do. So clearly, if you have a child with autism spectrum disorder, you should seek help from a professional, and so that you can more fully understand your options. And in my opinion, this should definitely be seeing a child psychiatrist or developmental pediatrician, as they are the experts with autism spectrum disorder. In rare cases, seeing a neurologist, a pediatric neurologist may be helpful as well. You should also have your child in regular therapy with an ABA therapist. If you do have PTSD, you should seek help from a psychologist trained in PTSD, especially exposure therapy, and at the very least get an initial evaluation with a psychiatrist to decide whether or not that you would be a candidate for medication. And obviously, if you're an advocate, which I would hope that most of us listening are, it would be a good idea to call your representatives at the state level regarding all of our concerns regarding medical marijuana.
All right, thank you so much, Dr. Ellis. That is greatly appreciated, incredibly important information for all of us to carry forward as we begin to go into the 2016-2017 session. Just to say some developments in Georgia regarding autism and PTSD. Some things that are happening are very disconcerting. Americans for Safe Access is a very savvy, sophisticated, knowledgeable marijuana lobbying organization that is national in scope. This is their website. You can see that you can click on medical, legal, medical professional, policymaker, and producer tabs, and each of those tabs have a great deal of information on them. Of course, not all of it is accurate, but it certainly looks like it is. You can even get certifications in medical marijuana through ASA. So it's a website that can be very appealing and attractive to many who may not know better when they visit that site. There is a Georgia chapter. This is particularly disconcerting. If you look about 2/3 of the way down on that website, you'll see an asterisk. And that asterisk says this action group, meaning the Georgia chapter, has a focus on pediatric uses of medical cannabis. So their target is children. And I'm sure many members of the Georgia chapter are well-meaning. Certainly a lot of the parents who are seeking help for their children are sincerely motivated by their child's well-being to seek any sources of help they can. However, as I'm sure most of you know, there's another side to this story, that compassion can serve well in the service of greed. There are billions of dollars to be made. Dr. Ellis has shared with you just how many children in Georgia have been diagnosed with autism. In some cases where the diagnosis has not been made by a psychiatrist or a developmental pediatrician, a very well-meaning physician without the requisite training may have misdiagnosed. But at any rate, there are that many children that have received that diagnosis, and that is a huge market. And that's really what it's all about. Bottom line for the marijuana industry is the number of new customers. There have been Georgia parents in the news advocating for high THC oil for children with autism, and again, many of these parents are very sincere in their heartfelt desires to help their children, and one can certainly understand their motivation in doing so. However, as Dr. Sabet and Dr. Ellis have pointed out, these high THC oils contain a variety of dangers, particularly for the developing brain. There is a Georgia dad with a child with autism who is publicly advocating, had been advocating up to 15% THC for his son and for others with autism. There's a Georgia mom whose story appeared in an NBC News story nationally with an embedded video. And I believe you can find that on the Clear Georgia website if you want to look at the story and play the video. She advocated for 75% THC plus 75% THCA twice a day for her young daughter. Again, could be very well-meaning, but those are incredibly high percentages of THC, and if those doses are being given daily or even near daily, you've got to wonder about the effect on the developing brain of that child. And when these news stories get carried over the internet nationally, you wonder how many autistic children begin to think that, well, this is the solution for me. And they're not going to make the distinction between an oil and smoking marijuana. They're not going to fine-tune it that much. So I think the consequence can easily be that a lot of children with autism are going to end up smoking grass in order to feel better. So what can CLEAR members and stakeholders do at this point? Many of our CLEAR membership, like myself, have been serving youth all their lives. I know I have been in the treatment profession myself, where I helped develop an adolescent chemical dependency program, where I saw hundreds of adolescents whose lives were made that much more miserable by marijuana. So there's an incredible amount of suffering on the other side of this too. Some of our members are parents who have lost children due to marijuana and other drug use, where marijuana served as a pathway to harder drugs. Marijuana in and of itself can be a devastating drug in the lives of many. And the fatal car crashes in Washington and Colorado, having doubled in recent years, that are marijuana related, point to that. But what can we do at this point? As Dr. Ellis's slide said, calling your senator, calling your representative, many have just simply not heard this other side of the story. They've heard what so many of us see on the media on a frequent basis, that marijuana is a medicine and not only not harmful but good for you and can treat problems like autism and PTSD very successfully. So to inform them of the scientific facts is something that is of tremendous importance. And I've learned in lobbying this last session that the minds of legislators really can be changed around this issue if you present them with the science. So we are planning some lunch and learns this summer and fall with senators and representatives around the state. It would be extremely helpful if you as a CLEAR member, CLEAR stakeholder, or other interested citizen listening to this webinar might want to send us the name of your senator and representative in Georgia. If you would care to join us for one of those lunch and learns, if your senator or representative happens to be a legislator that we invite, we would love to have you have lunch with us, because they're not going to listen to anyone like their own constituents. And we would definitely be very willing to give you an orientation before the lunch and learn regarding points, talking points to be presented to the senator or representative. Some of you rather not lobby, even as individuals, although it would be your First Amendment right to do so, except perhaps if you're a government employee, and then it's best to check with your supervisor if it would be okay. But at any rate, you can definitely policy educate without telling a legislator to vote yes or no on a particular bill or a bill to be. And policy education is an incredibly effective tool when used correctly. There are tremendous resources available to you for free. You can download these at clearga.org or Let's Be Clear Georgia website. We also have a Facebook page that you can go to. Learn About SAM is an incredible resource. Dr. Sabet and his staff are extremely dedicated to what they're doing, and a tremendous amount of extremely useful information. Sue Rushi with National Families in Action has put together the marijuanareport.org, another incredibly useful, knowledgeable site. These are the facts that our representatives so need to hear, the other side of the story. And on the right side of your screen, you will also see a document that you can download. This will be, it's posted to our website about why THC oil is not safe for autism. So that is available to you as well. Thank you so much for being with us today, and thank you so much for all you're doing. Thanks again to Dr. Sabet and Dr. Ellis.